Okay, when doing the thorax and lungs, the first thing you want to do is visualize the chest. You want to make sure that the color is good. There's no cyanosis. There's no pallor. There's no ribs protruding. They're not using any accessory muscles to breathe. Check chest symmetry on the front and in the back. You want to check both and make sure everything looks okay. Then you're going to check the posterior of the chest versus the transverse angle. And the anterior posterior should be half the size of the transverse to check to make sure there's no barrel chesting. Take the patient's respirations. You're actually going to tell the patient you're taking their pulse, and then you're going to count their respirations for a full minute. Normal adults should be 12 to 20 respirations per minute. You're also going to have the patient hold their fingers up, put their fingernails together, and you're actually checking to make sure that there's no clubbing, so that you can see that there's no pulmonary issues going on that are hidden. Then the next thing you're going to do, you want to visualize the thoracic muscles, so that when you start your assessment, you've got a visualization of where all the muscles are. You can actually palpate. You're going to start up here and work your way down. You want to make sure that you're not able to palpate anything, you're not feeling any rubbing or crepitus, it's not real tender while you're pushing on it. You're going to check for expansion, have the patient take a breath, and exhale, and your thumbs are actually going to separate as they breathe. That shows good chest expansion. And then you would do the same thing in the back. Put your hands together and make sure that there's a gap in your thumbs when they take a breath. The next thing you're going to check for is firmitis. You're actually going to put your hands on the patient, have them say 99.
99.
Again.
99.
Again.
99.
One more time.
99.
And you should be able to feel when they're talking the vibrations under your hands. And then you would do the same thing on the back, all the way down, the same way you did it on the front. You want to check for tracheal position. You're going to notch right here, and you need to make sure that the tracheal is straight up and down and it's not off to the left or right and it's midline. The next thing we're going to do is check the lung tissue. You're going to start at the top, and you're actually listening for resonance as you're tapping all the way down. Ooh, it changed. When you get over organs, the sound will get dull. And then you do that in the back as well. While you're back here, you're actually going to check for the diaphragmic excursion. And what you do is you have the patient kind of bend over a little bit. There you go. Take a deep breath. Hold it. You're going to go down. When you hear that tone change, you can exhale. You're going to put a piece of tape, and then you're going to start at the bottom. Take a deep breath, and then exhale for me. And hold it. You're going to go up, and where that tone changes, you mark another piece of tape and breathe. And you're going to do that on both sides. And you want that gap between those two pieces of tape to be 3 to 6 centimeters. And then on the right side, the tape will be higher because of where the liver is. Next, we're going to listen to the lungs.